Hello everyone. I am Dr. Mugdha Raut. I am a practicing gynecologist, obstetrician, and clinical reproductive immunologist. We have our centers. Dr. Raut's Center for Reproductive Immunology in Mumbai and many other places in India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using our patented process of lymphocyte immunization therapy, that is ImmuLIT, and other immunomodulatory treatments. In our practice, we come across many queries from our patients regarding lymphocyte immunization therapy, that is ImmuLIT. When they read or hear about the success stories of ImmuLIT, they also feel whether ImmuLIT will be beneficial for them too. So today, I am addressing some of these questions that are commonly asked to us, like, do I really need ImmuLIT? Will ImmuLIT be beneficial for me? But the most commonly question asked is, we don't have a child, all reports are normal, do we need ImmuLIT treatment to conceive? Here, it is very important to understand that there are many reasons for not being able to conceive. And in many such cases, actually all the causes of not being able to conceive are not ruled out. So all the possible factors must be tested, in which the tests for immunological factors must be done to confirm whether ImmuLIT will be required. Only then we will know whether ImmuLIT is really needed. Here it is important to remember that other factors for infertility may coexist with other immunological problems. Now, the next common question is, my age is 42 years. Will I be benefited by ImmuLIT? Here it is important to know that with advanced age, function of the ovaries diminishes, causing difficulty in conceiving. ImmuLIT treatment will not improve the ovarian function, but the immunological tests indicate a problem, then ImmuLIT will be needed. In fact, till the time a woman can conceive, whether naturally or by IUI or IVF, there is always a possibility of immunological problem, and ImmuLIT may be needed. Sometimes the couple asks, we have only one child, we have conceived naturally, and now we are not conceiving, or now we have repeated miscarriages or even IVF failures. Do we need ImmuLIT to have a successful pregnancy? Yes. There is always a possibility of immunological cause for this, even if the first conception was normal and the pregnancy was uneventful. The problem can arise after the first pregnancy also. We also hear from patients that they have undergone repeated IVF and conceived in each cycle, but always there has been a biochemical pregnancy. So, can ImmuLIT help? Yes. A biochemical pregnancy is like a miscarriage, and it can be due to immunological problem. And ImmuLIT is important in such cases. Now, sometimes the IVF is done with a donor sperm, donor egg, or a donor embryo. Will ImmuLIT with husband's lymphocytes be beneficial in such cases? Yes, if tests in reports indicate that there is an immunological problem, ImmuLIT is advisable. We can use husband's lymphocyte for ImmuLIT when even when a donor sperm, donor egg, or a donor embryo is used. This is because ImmuLIT is an immunological treatment and lymphocytes from any person will be able to induce protective antibodies and ImmuLIT will be beneficial. Patients usually ask, can ImmuLIT help me conceive naturally? If there is unexplained infertility, then ImmuLIT can help to conceive naturally if immunological problem is there. Sometimes, if the IVF failures are due to the unexplained cause, there can be immunological cause and patient can conceive naturally after ImmuLIT. Now, there are a group of patients with infertility with endometriosis and they ask whether ImmuLIT can help them. Definitely. Endometriosis has a strong immunological basis and is usually associated with the alloimmune problem, and ImmuLIT has a beneficial role in those cases. Patients with IVF failure or infertility due to thin endometrium usually ask whether ImmuLIT will be beneficial to increase the endometrial thickness. ImmuLIT is not a treatment to increase the endometrial thickness. However, we have seen some cases of unexplained thin endometrium responding after ImmuLIT, but it is not a treatment. Now, there are some practical questions also. My husband smokes, drinks, or he has high blood pressure or diabetes. Can he give blood for ImmuLIT procedure? Yes, he can. Of course, he should not smoke or drink for at least 12 to 24 hours before collecting his blood for the ImmuLIT. Even if the patient has diabetes or high blood pressure, she can take ImmuLIT treatment. The next question is, can ImmuLIT be done if the husband's report shows either hepatitis B, HCV positive? Yes, we can do the procedure, but not with the husband's blood. We will require to use lymphocytes from the blood of a donor who has been completely tested. Now, sometimes we get patients who have successful pregnancy after the ImmuLIT treatment in the past. They ask whether they will require to take ImmuLIT if they want to try pregnancy again. Now, the effect of ImmuLIT lasts for up to 2 years. So, if ImmuLIT has been taken more than 2 years, it is advisable to do the procedure again before planning the pregnancy. Rarely patients tell us that we have taken LIT before at some other center, maybe 3 doses, 5 doses, but they were not successful. Should they take LIT again with us? In such cases, we tell them that it is important to rule out other causes of failure also. And also, if the immunological tests still indicate a problem, the ImmuLIT procedure can be done, which is done with a unique patented process at our center. So, in conclusion, I would like to say that ImmuLIT is a very effective and a useful procedure, but it is not for all. A careful selection of couples who require ImmuLIT is very important to ensure excellent success rate of this treatment. Thank you.